get into that. Well, I'll get into it right now. From what is happening, it's purely politics. It has nothing to do with health care. It has nothing to do with cost containment. And I'll give you the proof. Kaiser, I'll give you a little bit of example. Kaiser Permanente was started by a guy by the name of Sidney Garfield, 1930s. He put himself through medical school selling used cars, so he understood business. And he said during this depression, why can't citizens self-insure? And he charged 35 cents per year. The Los Angeles aqueduct was under construction, and people were dying like flies because it was poor air conditioning. The tunnels were collapsing. People didn't use goggles when they welded. So he sent his physicians and nurses into the workplace and instituted safe working conditions. He cut the death rate and the illnesses by 95%. When Kaiser was the company that produces aluminum products, was making ships in Los Angeles during the Second World War, they heard about him. They said, come on out here and help us. Now you remember that during the war, there were 4 F people who were working: the frail, the young, the too old, and the too sick to go to war. He instituted the same types of cost-cutting measures, but good health, by self-insurance, and cut the illness by 65%. After the war, Kaiser said, I think we have a winner here. Why don't we get together? Permanente is the physician branch. They said, we want to remain separate and distinct because we're after quality care. The business comes later. The money will come if we give quality of care. Needless to say, there were big fights afterwards. I don't know if you've seen that old movie, what is it, The Godfather? Yeah. Almost the exact same thing happened at the exact same lodge with a fight between Kaiser and Permanente of who would rule, health care or money. I'll give you one example. When I was there, the organization was $5 million in the red. The Kaiser part told Permanente to come in and sit down, and they told him, we're taking it out of your salary. The physicians lost that money. The president of Kaiser Permanente got his $2 million raise. Now you guess where all the funds and all these VAT taxes are going to go to. You think they're going to go to your care? I just heard a radio program this afternoon. Governmental employees earn 70% more than the average private sector. Have no doubt the Obama health care program will be total control. It's a transition from a doctor relationship between you and your doctor to you and your bureaucrat. The nonpartisan Congressional Budget Office said that there will be no reduction in the actual cost of health care. Not $2 trillion reduction, but a $2.7 trillion increase. Let me talk a little bit about what is really occurring. They said that they would do 2 things, that they would cut costs and that they would cover everyone. Yeah. 1, it won't cut costs. 2, there'll be no universal coverage. The House bill will leave an estimated 17 million people uninsured. The Senate bill, 34 million people uninsured. The Obama administration says that there will be, that right now there are 40 million people uninsured. That's including young people who decide they don't want insurance. That includes people who are already eligible for Medicare or Medicaid and they haven't applied. It even includes people who earn over $75,000 per year. So if you take those out, you got 20 million who actually are uninsured. Let's cut the difference between the 17 and the 34 million, and you still come up with more people uninsured. The Mayo Clinic, which looked at this program and did an analysis, said, 1, the proposed legislation misses the opportunity to help create higher quality care or more affordable to the patient. In fact, it will do the opposite. The real losers will be the citizens of the United States. Now, the poor director of the Congressional Budget Office, Douglas Elmendorf, must be getting an awful hard time. Remember, he was elected by this present Congress and put in place, but he's been telling the truth. He testified before the Senate Budget Committee saying that the House and the Senate's bill did not have the sort of fundamental change that would change the curve of the budget. On the contrary, instead of going down, it will actually increase the curve for the cost. Let's look at the bill before us, and I've brought out a couple of quotes here. On page 124, and that's on the original proposal, that's not on the 3 that's now floating around or the 2 that's now in the Senate, says the government committees will decide what treatment and benefits you get, and there will be no judiciary nor legal appeal. All citizens, whether you're legal or all citizens, legal, all non-U.S. citizens, legal or illegal, will be paid for. The bill is sort of it's sort of complex. Fact.com says that yes, they will be covered. What the bill says is we will not require premiums of them. That's nice, no premium, but the care. Page 95 went on to say that but community organizers will be paid to go out and recruit people for this program. I'm sure that Acorn will get a little bit of money. Any individual citizen who is here who hasn't accepted health care from an approved program will be fined 2.5% of their gross. Oh, by the way, this is an interesting comment. And this is from that little bill that was passed earlier this year that maybe 2 people in the entire Congress read, but we knew it was good for us. It helped us out. In that stimulus bill, 3 programs were passed that their combined funding is more than the Army, the U.S. Army, the U.S. Navy, the U.S. Marine Corps, and the Air Force combined. These organizations are the National Coordination for Health Information. Those are the people that have the authority to ask the IRA to look in your bank account and all of your financial transactions to find out what you really have. And don't worry, if they find out that you don't have an authorized program, you don't have to send them a check. They have authorization to take it right out of your account. Yes, HSS and the Federal Coordination Council for Comparative Effective Research. That's that little death committee that they keep saying that isn't there. They have a calculation that looks at the quality adjusted life years. They'll put the cost of the medication and divide it by whatever that medication or that procedure will add to your life. And if it doesn't come under 1%, specifically 1.3%,